Do we have an infrastructure in place in this country and in the States that can handle the coming kind of online of big data in healthcare, or do we need to build it?
So my own feeling is that it currently is remarkably fragmented. I mean, the data sets sit with multiple gatekeepers who are, for more political and cultural reasons rather than technical ones, don't wish to share it.
So who are the gatekeepers, if there are many of them?
It can be multiple sources, through commissioners, through providers, through multiple sources where the data lies. Actually being able to access them, so Jim talked about having access to multiple data sets through registries. That's the exception in medicine, I would suggest.
Yes, and I mean essentially what we've had to do is go under the wire. I think one of the things we've done spectacularly unwell, I think is probably the best way of putting it, given I'm a civil servant, is these national initiatives to try and stitch our data together. The system is too complex and too difficult to do that. I know there's a view from North America, that the NHS has got a single badge and that the data is harmonised. Actually, when you get over here, it's as balkanised as everywhere else. And inside an acute provider, there are different systems. And so, when you ask Charlie, it is so fragmented. And so what we've done actually in the registries is, how do we get this data? Well, actually, we've killed some of the holy cows, and one of those is data standards. We simply go into an organisation and say, do you know anything about your patients? And their name, address, postcode, date of birth, and then what we do is we develop systems that will take data out of any system so easily that we just take the data, we take the pain at the centre and stitch it together. And I think that model is something that then scales. Because what we found is scaled, in 2011 we did 500,000 clinical records. Last year we did 32 million, and next year we'll do 250 million records. And all of those are coming out every week from every system, and yet the NHS is still going through this churn. So I think we need to change our mindsets. And I think there are lessons out there. You've got it in CancerLink in the US. There are examples where these very fragmented healthcare systems can begin to join their data together.
So, Lloyd, give us the picture from California, which I imagine is way out in front of
I think
anything we're doing.
The fragmentation of the data, of healthcare-related data in the U.S. is certainly palpable every day for those of us who are treating patients. I mean, it's easier for me to, obviously easier to go to an ATM and perform a financial transaction than to get my medical records, from a primary care physician to a doctor in the same building even, practically the only use of fax machines anymore is in transmitting medical. I mean, how many businesses do you know that use fax machines outside of physicians and hospitals today, right? So we're very, very far behind. But the resources exist. I mean, it's not like storage systems don't exist for data sets the size of clinical data systems today. They do exist, but they're not being utilized by by provider organizations or healthcare delivery systems. So how can we get the technology deployed in a way that makes the data useful for deriving information? Is going to drive better healthcare and a learning healthcare delivery system, but at the same time protect the security of the data and very, very importantly, as has been mentioned several times, earn the trust of those patients who depend upon us for their care and also to maintain their privacy.